Right, so today I just want to use the MRI to explain briefly what rib pain is, where it's actually coming from, and just to show you a little bit about the thoracic spine. So firstly, let's have a look at the anatomy, and this is the thoracic spine. You can see the vertebrae are numbered T1 to T12. In this case, we see a little bit of whitening or sclerosis representing early signs of osteoarthritis. Here we're looking at slides. All right, so here we are back to the midline. These are the spinous processes that you can feel along your back, and this is the front of the body. This is a normal curvature looking from side on, okay, nothing untowards. This is the airways, the trachea. We can see the little bumps from the cartilage. As we zoom out, we are going into a normal lung field, which basically starts from T1 all the way down to T12. Here we have the diaphragm and the normal lung markings. These are the cross-section through each of the 12 ribs that basically go onto the spine. So that's what we're here to look at today. This is a front view of the same area with the spine, the ribs coming off, and the normal lung markings. Now, if we have a quick look at a cross-sectional view of this area. So firstly, here we have a neck vertebra. You can see there are no ribs attached to it. The spinal cord is in the middle here. And as we travel down, then we start to see where the ribs join on. Let's go down to here. All right, so here we have a thoracic vertebra. This is the vertebral body, the spinal cord, the transverse processes, and the spinous process. As you can see, the ribs here come around, and they actually have two attachments onto the vertebra. One, they attach onto the vertebral body at the front, and they also have an articulation with the spinous process just on the side there. So there's actually two types of joints involved with each rib. Okay. Now, the majority of injuries that happen from ribs is often from the twisting and the rotation. A normal rib has what we call a bucket handle movement, where the rib is attached to the back and the front, and as you breathe in and out, the rib is allowed to basically go up and down as you breathe in, and then breathe out again. So this is a normal type of bucket handle movement we would expect. If there is too much force placed on these joints, either from bending and twisting, then here you will see that the joint, the costovertebral joint, either one of these two can actually, generally the one at the front here can actually get inflamed, and the joint basically seizes up. So the idea of the adjustment is to contact the rib just at the back here, and as we provide a thrust, we actually gap the rib away from the spine in order to free it up. So that's where we are looking at. Again, a bit further down, so a bit more of an angle, and you can see the two articulations cleanly. These are the muscles at the back. If the rib is adjusted early on, the person will often experience almost immediate relief within a day or two, especially if we use that in conjunction with anti-inflammatories, and very rarely do these things actually develop. If the condition is allowed to progress and it just keeps getting worse, then you find that it becomes a bit of a domino effect, where one rib pulls on the next two and the next two, and then instead of being a single joint that we're dealing with, it just becomes the whole side of the back, and that can take a little bit longer. So as always, if you're experiencing rib pain, get some professional help straight away and get on top of it.